solutions that have a really large impact in the environment for all members of our community. And this year, the award is presented to an elected official who worked to make Multnomah County a leader in combating the obesity epidemic. So Commissioner Kogan, if we could come forward. I get to give him this because, you know, he is the commissioner, so. Thank you. And I have to tell you his story, too. Commissioner Kogan, when we say he led this effort, I want to tell you some of the ways in which that happened. This policy is a key strategy. It wouldn't have happened without his leadership. Multnomah County is the third jurisdiction in the country to implement menu labeling. It's a key strategy against working against overweight and obesity in our community, and we know, to our surprise and horror, and to recommit ourselves, over 50% of the adults in Multnomah County fall into the category of overweight or obese. They are putting themselves and putting our community at risk for a variety of chronic diseases, such as heart disease and diabetes. The work of this policy initiative is to make it easier for people to take control of their own lives and to change those conditions going forward. There's a lot of support for menu labeling among the general public, but it didn't mean that there weren't a lot of powerful voices against it. And Commissioner Kogan was completely steadfast in his commitment to make nutrition information available to the dining out public. I'm going to give you a quote on some of the things from our chronic disease manager, Sonia Manhouse, who was the staff person who worked with his office and him on this initiative for the board. He went well beyond supporting the policy initiative. He took the time to understand the intricate details of the policy. He took a lead role in educating his fellow commissioners and other electeds and the public, not only about the policy initiative, but about the epidemic of obesity and the chronic diseases in our community that result from it. Some examples of how he got involved in the nitty-gritty of moving the policy forward. He made the case to the Oregon editorial board. He actively reached out to multiple media sources. He held events to celebrate organizations and restaurants' decision to implement menu labeling earlier than required. And he coordinated numerous meetings, and he reached out to his colleagues in the state legislature as well. I'd like to note that Commissioner Kogan is the first and only commissioner ever to be nominated even for this award. His actions and commitment to public health align exactly with the criteria of a real public health leader and honor to have you as our commissioner. Thank you so much.
Thank you. I'm really psyched about this. And, you know, I've noticed that everyone else who got an award gave a very short and tasteful speech. But I'm a politician. This may be the last time you ever nominate an elected. I have a few things I want to say. Comfortable, not just you know, I am really excited about this, and I'm really excited about the work we did on menu labeling. I do think it's a really important public health step forward, and I think the state of Oregon is going to follow in our footsteps, which I think is a terrific thing. So I want to say, you know, as I've been thinking about this, at first I am very flattered. But as I thought about it, the notion of me being a hero was kind of silly, honestly. Because a hero is, you make believe this one guy who makes something happen, jumps through a burning window, and it's really not like that at all. I'm very happy we made this happen, but I want to just talk about how it really happened. I mean, first of all, the overwhelming leadership here was in the health department, particularly Sonia Manhouse, who did a tremendous an awful lot of time working with a diverse stakeholder group to come up with a very reasonable, very positive proposal, and that was not easy. It took many, many months. After that happened, and I said I'd be willing to try and push this forward, I wasn't able to push this forward myself. Carol Collingworth from my office worked with Sonia and helped activate the public health community, which weighed in huge measure, which was really necessary because the fast food industry fought this tooth and nail in a very misleading and very bitter campaign. And if folks in the community hadn't pulled together and weighed in and said, yes, we want this information, it wouldn't have happened. And then finally, my colleagues on the board, the last board and this board as well, had to stand up to that pressure and to resist very, very powerful lobbyists and say, look, we know this is the right thing to do. And so it's everyone together that made this happen. And I'm really proud of the fact that we all came together and made this happen. And I think that we can come together and make other really cool things happen for public health. So I'm really fired up about that. Thank you very much.